I think the biggest issue that the Commission has to grapple with is the fact that we have an ageing population with multiple needs and multiple conditions, and our current health and social care system is not fit for purpose now, let alone for the future. I would like to see the report address the importance of including housing. Housing is so important. It can't just be health and social care. Social care funds a lot of housing, and housing, frankly, isn't fit for purpose for a lot of older people or people over the next 20 years. Too many people, particularly vulnerable people with dementia, are in hospital, and people's own homes are not necessarily fit for purpose, and some care homes aren't. So I think to make it work, we have to join up all those issues, and the funding and the future direction is going to be really important, I think, in all three areas. The boundaries between health and social care change so often that I think what we need a period of consolidation, but I do think what we need to do is to make sure that health and wellbeing boards and all the services that health, and I would also say housing, are involved with, come together nationally and locally, so that leaders work together and we actually think, about integration in a more sort of positive way. But around, the boundaries that we have now, I think another reorganisation may be a step too far. I think in an ideal world, we've talked about this for many years. I think we need to look carefully at how we do that, but I do think, we have national funding, we have local funding. There must be better ways of making sure that the person gets the package of care and the services they need. So I can't believe that the Commission and other experts can't find ways of joining up the funding systems in a way that makes sense nationally and locally. We had a very good event today with a lot of people from different sectors, different walks of life coming together, but the thing that we were all focused on was that we really do need to make our services based on the needs of people. They need to be much more personal. People's needs need to be shared. Most people do want to share their needs across settings and sectors, and I'm particularly concerned that as people get older and people towards the end of their lives, their services are included as well. People need to live well and die well.